Hi, I'm Dr. Jeff Banas, and I'm going to talk a little bit about a technique that not a lot of people know about, but is actually very effective of getting relief from sports injuries, from chronic pain, and areas that are just really stubborn to treat. If you're suffering from some type of muscle pain, hamstring pain, neck pain, and you've tried some like massage or foam roller or the stick, and you're getting a little bit of relief from that, but it's temporary or it's transit. So you get a massage and you feel good, but then it feels like it comes back. Or you got knots in your shoulders or tightness in your calves. We'll see a lot of runners, triathletes, they got a lot of tightness in their calf. And they're constantly using that foam roller or using the stick or trying to dig that out of there. But it just doesn't quite to get it. What you need to start looking into is what's called dry needling. And dry needling has been around for a long time, but not necessarily a lot of people know what it is or do it. Dry needling is basically where you're taking a needle, and we use acupuncture needles, and acupuncture needles are very thin and very fine, so they don't cause as much pain as like if you're getting a blood draw or some type of injection. Most of the time you don't even feel it. So what you typically do is you'll feel it around into the hamstring or your calf or wherever you feel that trigger point or that knot, that spasm of that muscle where that muscle's in spasm. And we'll find that trigger point in the muscle, we'll take an acupuncture needle and just tap that in there. And once we kind of tap that in there, in that needle, what it does is many times it'll cause a twitch response, and it causes that muscle to just twitch and then that release, and it just relaxes that muscle. Another thing is what the needle, in poking it into that trigger point that that muscle knot does, is help in circulation. And when you have chronic muscle spasms and tightness, anything that increases circulation is generally going to be helpful for that condition. So if you have one of these people have found yourself the tightness in the calves or a hamstring or a quadricep or the neck or the back, and it just feels like you just need to stretch it out or dig it out or try to break it up, that's where you really want to think about dry needling. And a lot of sports chiropractors will do it, and physical therapists will do it. It really doesn't hurt at all. You feel just maybe a little tap and that needle goes in, nothing even close to like a trigger point injection would actually inject a substance in there or a blood draw. So really look into it. It's very effective. Gets quite a bit of relief for those chronic muscle spasms and tightness and those myofascial pain disorders.